there, good evening to you and welcome to Express Update on Clock TV. My name is Annabelle Bethany Jabia. Coming up in the next few minutes, President Mahama urges global investors to view Africa as an opportunity, not a risk. Also coming up, Parliament temporarily holds sitting to host anti-LGBT conference in Chamber. This and another story is coming up shortly. Do stay with us. In our first story, President John Dramani Mahama has called on global investors to rethink their perception of Africa, urging them to see the continent as a hub of opportunity rather than a region of risk. Speaking at a 4th Africa debate in London on June 3, the president described Africa as the next frontier for global growth, innovation and investment, citing its youthful population, rapid urbanization and expanding consumer markets. He encouraged investors to move beyond traditional narratives of uncertainty and focus on the continent's immense economic potential and long-term value. The remarks were made during his working visits to the United Kingdom, where he engaged government officials, investors, and members of the Ghanaian community to strengthen economic ties and attract investment to Ghana and the wider African continent. In our next story, Speaker of Parliament Alban Suman Kingsford Bagbin has suspended parliamentary sitting for 3 days to allow the parliamentary chamber to host an African parliamentary conference on LGBT-related issues. The conference, which has brought together parliamentary leaders from across Africa, is focused on discussions surrounding what organizers describe as external influences on African family values. The event is being held in Parliament's main debating chamber and is expected to run until the end of the week. Now, the development comes shortly after Ghana's Parliament passed the Human Sexual Rights and Family Values Bill 2025 on May 29, 2026. Despite the bill's passage, Speaker of Parliament Bagbin has appealed to Parliament to reconsider aspects of the legislation. Parliament is expected to resume sitting after the conference concludes. The Komfo Anokye Teaching Hospital has resumed emergency admissions after temporarily suspending new cases due to overcrowding at the Accident and Emergency Center. Speaking to the media, Acting Media Director Dr. Yao Labi said the pressure on the facility has reduced slightly following efforts to improve bed availability. He explained that Komfo Anokye Teaching Hospital has engaged both public and private health facilities to temporarily manage some emergency cases and refer patients when necessary. According to him, hospitals with the required equipment but limited specialist personnel will work closely with the hospital specialists to ensure patients receive the needed care. Dr. Labi also called for the upgrading of existing health facilities in the Ashanti region and urged authorities to operationalize the Afari and Siwa Hospital to help ease the burden on the facility.
Soon after we issued the statement, the Director of Public Affairs issued a statement yesterday, we had a meeting, a Zoom meeting with the Regional Director of Health Services, his Deputy Director of Clinical Care, and medical superintendents of a number of the facilities who refer cases to us. I'll say Ghana Health Service facilities and a couple of private facilities. In this meeting, we made them aware of the situation here, and they are already our partners. We collaborate a lot in the care of patients. So we told them the situation, and then we made each of them present, tell us about their capacity. So they told us about their capacity and the current state of their various facilities. For those who had emergency areas, they told us the number of beds that were available. Some people told us the beds available in their male and female wards. For instance, one of our facilities we work with, Hope Exchange, mentioned that their male ward was full because over the period, because we were having a lot of congestion here, a number of patients were also getting to their end. And as of yesterday evening, they had only 3 beds in their female ward. So if we had patients who were females and didn't require surgery or ICU, they could take. And similar information was given to us from the medical superintendents of other facilities. So they were prepared to hold patients who were in their facilities waiting to be referred, to keep them for a while and manage them together with us, because we can do management on the phones with them. When they describe and send us some parameters, we can intervene. Others too were also prepared to receive referrals from other facilities, and they described the kind of beds that they had. One facility even said that they had ventilators and they had beds. The only challenge they had was that they didn't have the requisite personnel, or I'll say the personnel with the requisite skills to manage those units in their facilities. So if we could spare people, then the places were available for management of patients. So after that meeting, what we've done is that we are now accepting patients, because we are gradually working on the patients, the almost 40 patients backlog that we had. And I have been through some of the wards this morning. The bed stage has only improved slightly. I must tell you that the entire D block, when I did my rounds this morning, had only 5 beds available. However, there are other wards that I haven't been to. Yeah, so it tells you that we still have a challenge with beds, but because we know the critical role that we play in the country, looking at the number of facilities who refer cases to us from 12 of the regions of this country, we are now receiving referrals. Though it looks a bit quiet down there, but I believe when you pass down there, you must have seen patients who are still, some on beds, some on stretchers on the floor. So it tells you that we are still managing it, still trying to admit patients. Any patient who arrives will be attended to.
Survivors of the June 3, 2015 twin flood and fire disaster have renewed calls for government assistance, citing years of neglect and unfulfilled promises.
At a memorial event marking the tragedy's anniversary, a survivor identified as Lydia expressed disappointment over what she described as a lack of support from successive governments. She claimed some administrations had declined to assist victims because the disaster did not occur during their tenure. The June 3 disaster, which struck at the Goyle Filling Station near Kwame Nkrumah Circle in Accra, claimed about 150 lives and left many others with lasting physical injuries and emotional trauma. During the commemoration, survivors and advocacy groups, including the One Ghana movement, called for renewed attention to the welfare of victims.
NDP force who say, and your more time, Nadia no see and the woman she be NDC that. This is a mosa by no more than who share. Then who they be? Almost the NDC time, then Sana, NDP from Kaiser NDC time. And see, almost no she be. For a protect from Sana on catch right. So say NDC as I have. And she say no. A boy be or what? Mufama said the good way no muka. Mufama and so if I hear. We need one to say, and ye, they be I mean, watch it up. It's a mobile boy.
In our last story, the Ghana Private Road Transport Union has suspended its planned 20% increase in fuel prices, which was expected to take effect from June 2, 2026. Speaking in an interview, Mr. Ben Boahen, Communications Officer for GPLTU under the Trades Union Congress, said the union decided to pause the increment and wait for the window price review. Mr. Boahen therefore urged drivers to hold off on implementing the increment until fuel prices are reviewed. And this has been Express Update on Clock TV. My name is Annabelle Beverly Jabia. Thanks for staying with us.